In Africa, quality healthcare has been noted as one of the biggest challenges in Africa, with some of the states having a doctor-to-patient ratio of 1 to 100,000. But this sometimes might change because with the advent of cutting-edge technologies like AI, some solutions are coming up which may revolutionize this state in Africa. And today we are going to discuss about democratizing quality healthcare in Africa. And in our studio we have, if not the biggest AI specialist in Africa, then it's one of them. Today we have Darlington Akogo from Ghana. So, sir, thank you for gracing our studio and welcome. And if you have not been welcome to Kenya, take this as an official welcome.
Thank you. So, Asante.
You know that?
Yes.
Yeah, karibu. I answer karibu.
Exactly.
So maybe you can just start with a brief introduction about yourself,
sure.
What you do, right. And maybe why you are in Kenya right now.
Okay. Yeah, so my name is Darlington Akogo. I'm the founder and CEO of MinoHealth AI Labs and also Kara Grow AI. And then two other AI organizations actually. So Ranmila AI Institute and Gudra AI Studio. So essentially what we do is that we build AI solutions for different sectors. For MinoHealth AI Labs, the focus is healthcare. We build AI solutions that automate diagnosis, prognosis, forecast, even working on drug discovery. So we have AI systems that you can give medical images to and they'll interpret it. And so I'll be talking more about this and then maybe some of the general side of AI too as well. Why I'm in Kenya is that we actually came here doing a conference called the Applied Machine Learning Days Africa Conference. So this is an interesting conference in the sense that machine learning being a new field is very novel. So there's a lot of research work that is still going on. But there's a need for applied solutions, solutions that can be adopted and be beneficial to people today. Yeah. So this conference was focused more on the application side, not so much on the research and then you just publish paper side. So that's why I'm in Kenya. This is not my first time in Kenya, but it's, you know, I really, really love Nairobi. It's a very beautiful city, highly energetic, and I've been having a lot of fun just meeting up with old friends, meeting new ones, and also, you know, forming business partnerships right here in Kenya.
Wow, that's nice. So maybe you can just take us to an introduction about MinoHealth AI Labs. Yeah. What do you do? What's your mission? What motivated you to start this innovative solution to Africa and the world at large?
Yes. So with MinoHealth AI Labs, essentially what drove us is what you also mentioned, the numbers, right?
Yeah.
And the numbers, you can look at it from a purely numerical point of view, which is that you have somewhere in Malawi 60,000 patients to one doctor. If you take radiology, you're looking at, you know, all of, in South Africa, it's one radiologist for every 100,000 people. Or in certain places like Liberia, there's less than 5 radiologists in the whole country. But without knowing these numbers, because if you go on the street and you ask people what is the doctor-to-patient ratio, they don't know it. But what they know is that they don't get access to healthcare immediately. In a number of African countries, what people know is that they've lost relatives, friends, because they got there and there was no specialist, or they were busy, they couldn't get care immediately when they needed it, and they lost people. So being what is called a tech utopianist, because we grew up watching tech, you know, all the exciting things that was being done by tech, being inspired by the likes of Steve Jobs, Bill Gates, we were convinced that you can solve any problem with technology. So coming from that perspective, I was thinking we cannot have healthcare like this in Africa forever. There should be a better way of delivering this. So is it that maybe we haven't leveraged technology enough? So that thought is what drove into MinoHealth AI Labs. So eventually it became clear that if we can build essentially digital doctors, or at least digital clinical assistants that can work with a few doctors around, we can provide care to essentially everyone on the planet, not even just Africa, on the planet. So that was the mission, and we've done a lot of work since then. We've built AI solutions for radiology, so they can look at medical images. We've done it for microscopy. They can detect malaria from looking at microscopic slides. We've done it for oncology. We can detect cancers, and then the list goes on and on.
And you have said it can analyze images. Maybe if you can tell us, how long does it take to provide the results?
So it actually takes 5 seconds.
Wow.
Yes, maximum 10 seconds. That's if you have bad internet.
What about the accuracy? What is the accuracy level of this?
Yes. So during my keynote address at AMLD, right, I showed this graph. So in the graph, we compared, again, we want the AI systems to be assistants to clinicians, not their comparative, right?
Yeah.
But even then, we evaluated them in comparison to clinicians. And then we saw from the performances, individual radiologists scored within a range of 70 to 80. The model was scoring 80 to 90.
Yeah. Wow.
Even 97%. No, it wasn't 80 to 90, it was actually 90 to 97%. So that is the huge gap that is there. The only time they become comparable is when a group of radiologists are working together.
Yeah.
And if there's a shortage, you can't have 4 radiologists looking at a single medical image. So the benefit here is that if we are providing this as assistant to clinicians, and the assistants have this high level of performance, that's going to be really beneficial.
Yeah, sure.
And so, yes, but we see this, but it's also important to make note of this.
Yeah.
There are certain mistakes that the AI system makes that doctors will never make.
Yeah.
So right now, the key thing is combining both of them. AI systems are not perfect, neither are doctors. So the AI system is going to see things that the doctor will miss,
Yeah.
and then the AI system is going to miss things that the doctor will see. Access to everyone.
Sure.
Yes.
Yeah. You talked about a very important point whereby an AI can see something that a doctor won't see and vice versa.
Yeah.
So, and this drives me to this question: how do you take care of bias? Yeah, in these results. And second tied to that question is about privacy. Privacy is very important, and in Africa, when you're going to see, not maybe in Kenya, let me speak in place of a Kenyan.
Right.
When I go to see a doctor, I usually, maybe I'm not sure of what I'm feeling because I sometimes them embarrassing, and I don't want someone else to see this. So when I consult this AI doctor, how sure am I that my information will be private, and someone might not get into my account and see what I've been chatting with the bot or something?
Yes.
Yeah. How do you take care of that?
That's a very good question. So the starting point is looking at data protection laws, right?
Yeah.
So a number of about 70–80% of African countries have data protection laws. And one good thing they've done is that they have a forum where they meet about every year and they make sure there's some uniformity across these laws.
Yeah.
So if you are compliant with data protection laws in one country, you're mostly compliant across board. So that's one thing we paid attention to, data protection laws. So within the laws, there's something called personal identifiable information.
Yeah.
So even when you're building the AI system, you want to make sure that you take those information out. Then there's things like right to access, right to deletions, and all those things. We factor it in. Now, even in Europe, you have GDPR. Some of these laws are still essentially the same framework.
Yeah.
So we are very compliant with GDPR, data protection laws across different African countries and stuff like that.
Yeah.
The other bit is you need to always be 5 steps ahead when it comes to security. The good thing or the tricky thing about security is that you can't even talk about what you do to keep things secure. Because once you talk about it, you just made it less secure. But cybersecurity is very, very important. So this is some of the things that we take, like we have systems that are, I can't go into full detail, but we have systems that even monitor our systems to see if there's unusual behaviors. So whenever I notice there's a pattern, to alert us that it's seen some funny behavior. So yes, that way we make sure that no bad actors is getting access to anyone's data. And then we are hosting this data with reputable institutions, right? Sometimes there's a tendency, because there are certain African countries that tell you that as part of their law, they want you to host the data locally within the nation. The question is that, okay, does a nation have the capacity to keep the servers and everything secured compared to someone like Amazon? Amazon is a global leader when it comes to cloud computing. So keeping your data with them is much safer than, let's say, a government agency that has been set up in a single country. You cannot have the same level of security. So we keep it, with some of these big players, and we add our own layers of protection and security on top of it to make sure that the data, and we don't share anyone's data with any third party at all. We don't do that.
That's awesome. And just in line with the security, when in Kenya, when you're doing anything related to medicine or something or health, you need approval from relevant bodies, especially from the Ministry of Health. And in Ghana, I saw you have been approved by FDA, the Foods and Drugs Authority. And you are now operating cross-border in different countries, even out of Africa. So how do you take care of this approval? Have you been approved in all these countries where you are present, or is it only in Ghana? And how do you take care of these operations across borders?
Yes. So that's the tricky thing about regulation. Regulation is national because every nation is a sovereign state. So even if a drug comes from America and has been approved by FDA, US, once it enters Kenya, Kenya has to do its own review process and approve it. But also, it is not practical to see an AI system that is used in over 50 countries. We should get regulatory approval in 50 countries. That will take forever. And we are going way beyond 50 countries. We are going to release our next version and probably double those number of countries, probably be over 100 countries. It's not practical to get regulation in all, regulatory approval in all those countries. So for us, what we are doing essentially is that we are targeting certain key markets that will get the certification. And it's mostly a way to signal to your users that this is safe because it has been vetted. And it depends on the level of maturity of the regulator. So Ghana like this has a level 4 maturity. That's one of the highest. There's only one level above it, which is level 5. And level 5 is essentially US FDA. And so if we get level 4 now, we'll work on level 5. Once you get those two, you are basically telling everyone, hey, this has been vetted and it works. So that's the reason why we get those certifications, because and this is also something that I've had discussions and debates with regulators. We need a different framework. The world that we used to be in, where everything happened on a sovereign state level, is not good enough. Because if right now, you know, a number of countries tell us that if you don't get certification, your AI system would be banned from our countries. There are lives that we could save. And you're saying that until we go across over 100 countries to get certification, we are not going to save those lives. I don't think it's the best. So we like this, we work not only on the AI solution bit, we actually work with regulators to develop new regulations. So working with WHO, working with, you know, regulators from around the world. And this is one of the ideas we talk about.
That's nice. And talking about key markets, from your analytics and so far your operations, what are your key markets? Which countries?
So Ghana, obviously, because that's where we started from.
Number one issue,
The funny thing is that if you have to guess the second largest market we have, if you try to guess, what do you think it will be?
South Africa?
It's actually America. That's surprising. And we did very little effort in marketing what we're doing in America, very little effort. We just opened it up and then talked about it that, okay, this is the AI solution we built. So our second largest sign-up comes from the US, then you now have like Nigeria, then you have different African countries, then it then goes somewhere Europe and then comes around. So we are taking that as signal. So as a matter of fact, we're actually putting together a partnership. We'll be going into more details soon about this. We are just signing the agreement now, but there's a partner in America that wants to give us 6 billion medical records and then roll out our AI solution across not just USA, but North America. We even have partners in Brazil that want us to come over and then roll out our AI solution to help them with breast cancer detection and screening and stuff like that. So essentially, these are some key markets that we are looking at. Especially, so one of the key things is, since at the end of the day, we want to have real-world impact, is the number of lives that we are saving, right? So if a country comes to us on a national level and says that the Ministry of Health wants to adopt your AI system and roll it across all public health sector, then we put it very high on our list.
Talking about USA being your second biggest market, we understand that in Africa, the conditions are not the same as US, are not the same as maybe Asia, maybe Europe. When you're feeding data to your systems, do you feed data from different parts of the world, or is it just in Africa, and how do you take care of bias? Because I believe a condition in Africa might have the same symptoms as in the US, but maybe not the same medical problem. How do you take care of bias in such situations?
So a good way of addressing bias is always having good representation, right? So that's why we are forming all these partnerships around the world. Not only in deploying the AI system, but even getting data to train newer versions of the AI system. So we have one partnership also in West Africa that is giving us 100 years worth of medical data in West Africa. Combine it with the 6 billion in the US, the Brazil one, then already we have North America, South America, Africa. We're also going to put together partnerships in Europe, in Asia, Middle East. So we basically aggregating data that is very, very huge medical data that is representative of the human biology. And so you are right. What happens is that since there's a lot of diversity, diseases also mutate. Especially cancers, what they look like in different parts of the world is different. There's a reason why if you take something like breast cancer, it is very rare to see in Europe someone below the ages of 40, 30 developing breast cancer. Not uncommon in Africa, not uncommon especially in West Africa. I know people personally in Ghana that are 20, 30 years and then they develop breast cancer. That is not common. So there's clearly some mutation there. Sometimes it's referred to as epigenetics, how the environment influences some of these genetic conditions and stuff like that. So, but there's also one interesting thing, which is that, yes, the whole globe, we are diverse, but when you look at Africa, we are the most diverse, biologically.
The cradle.
Exactly. This is where it all started. So, in just even a whole continent out there is based off a tiny fraction of what came from Africa. So you have all the biological diversity here. As a matter of fact, I was having this discussion with a professor and he was telling me this. People from, let's say, the country Ethiopia, biologically, are much more similar to, let's say, Europeans than to people in Ghana, West Africa. Implying that, I mean, we're all Africans, by implying how biologically diverse we are, right? Everyone essentially in the world today can be traced from a single ethnic group in South Africa, the Khoisan people. So when you have this level of diversity, what does it mean health-wise? It means that if we truly tap into that data with AI systems, we can essentially find new cures for cancers that has not even been discovered yet, because there's so much hidden in our biology that we haven't tapped yet. So essentially that's one of our biggest bet, doubling down on the data we have from Africa and building models around that. So even already we are looking at partnerships right here in Kenya with some of the top facilities. We'll do this across different African countries and then take that solution and take it around the world.
In Africa, we have deficits in network connection, internet connection. But in Kenya, we are lucky our government is doing something on extending the broadband for Kenya. But Africa at large, if I try to understand democratizing quality healthcare, I understand that we have to reach even the grassroots areas, rural areas. Now, how do you make sure that your services reach these people? Because I understand maybe there can be need for partnerships or something. Maybe do you have partnerships that helps you do this democratization of quality healthcare in Africa?
Yes. I mean, so if that, the question is quite loaded because you also mentioned some of the limitations, right? So infrastructural limitation, you're looking at internet access, you're looking at even access to electricity. And so, yes, those are some of the major things that we still need to address. And you're right, like Kenya is phenomenal. Like I have 4G almost everywhere. So I remember when I got in from the airport and I was headed to the hotel, I was very confident that I was on a call. And I was confident that this call is definitely going to break because that's what happens everywhere. Not just in Africa, not just in Ghana, everywhere. But for some reason, the call was smooth throughout the whole journey from the airport to the hotel, which is like about 30 minutes. It's like, what is going on here? And then I check it's 4G throughout. That's impressive on a global level. And you know, other people in the conference that came from all over the world says the same thing. So clearly we can do much better. Kenya is proving that we can address the, you know, the internet gap. And then also there's the internet gap. But then, like you stated, if you're going to democratize things, you can't just do it in the capital cities and say you're democratizing. Because people in the capital cities at least can afford healthcare in one way or the other. Where it's really needed is the grassroots, the remote areas. there are different partnerships that we are looking at to do that. But then sometimes it's also just working directly with the health institutions that are over there. So we are a for-profit entity, right? We charge certain rate for our AI system, but we work with facilities that are in remote areas and charge way less. Sometimes essentially close to free, if that's what will allow them to be able to access the AI systems there. So even in Ghana, we work in some of the places far away from Accra, where it takes several hours to even get there. And then you have these facilities that are able to then provide people with those AI solutions and stuff like that. But there's a lot more we could and should do in that space. So one of the things we are looking at is using AI or making sure our AI system can run without internet. Which is kind of, you have to make a bunch of trade-off. Because it can run on the internet, essentially you can access it with any device connected to the internet. But once you make it offline, then you need a device that is at least powerful enough to host the AI system. But yes, we need to do more as far as taking it to the grassroots. We haven't have partnerships that with Imperial College London looking at all of these handheld devices for detection of malaria and stuff like that. Now, for those devices, you can actually take it to remote areas. So over the years, we'll do a lot more to make sure that it is well, we capture all the corners of the continent and the globe, even the places that you cannot easily get access to, zero internet connection. We need to find a way to get there.
There are some speculations that AI is going to cut down jobs. And in this case, we're talking about healthcare. How are the jobs of healthcare practitioners safe from invasion? Do I use the word invasion of AI in this space?
Invasion is a strong word. Okay. This you're right. This is one of the highly debated topics globally, even because there's data on both sides, right? As a matter of fact, just last week, so a company that does this, one of those, is it buy now pay later type of business, right? They used to have a lot of people who run their call centers so that when people run into issues, customer service issues, they can respond and everything. They let go of 700 people because they just adopted an AI system internally that can do that. So they didn't need 700 people. And as soon as they went out with that news, there's another company that just provide, call centers and then, people who do the customer service calls and everything. That's their business. It's built around providing it to other business. They lost several hundreds of millions in value because of that news. Because people realize that, okay, your whole business, we don't need all these people. What's the name? Even in the movie industry, Tyler Perry recently said that he's holding back on expansion of, is it 800 new jobs that he wanted to have for. When you saw there was this news about the AI system that can generate the videos, right? He saw it and it's like, maybe I don't need to hire all these new people. So there's a lot of data on both sides. But what I would say is that in the long term, I don't see anything that AI cannot automate. I don't see it. But in the interim right now, for most sectors, AI cannot be left alone to do anything. In healthcare, we have never told anyone that you can use our AI system without doctors. That's a terrible idea. Don't do it. The AI system brings a lot of value. But that value is best appreciated when a medical doctor is present. So I would say, at least in the short to medium term, this is not a big issue. But we should definitely start preparing for a world that has more AI doing more work and humans doing less and less work. The question goes back to, what is the goal? Is the goal saving lives or ensuring we get as many jobs? But realistically, the demand outweighs the supply in healthcare. Again, we looked at all those numbers. So I don't think the few doctors we have in Africa should be worried about losing their jobs anytime soon. They are good.
What are your success stories?
So, because the value of what we are doing is both on the overall numerical level and then the personal level. So numerical level, the fact that our AI system is being used in over 50 countries, and now it's probably somewhere close to 60 actually. that has been, one key impact. The other one is on a person. So we actually spoke to some clinicians, right?
Yeah.
And they told us that there were this specific incident that they took.
Yeah.
It was a very tiny lesion. So this is usually called a nodule or a mass. And this is associated with cancer.
Yeah.
So lung cancer. But it's tiny enough that for a radiologist, because they spend too much time, they have a lot of, what do you call it? A lot of images to go through.
Yeah.
It takes too long to pick up on some of those stuff. The AI system was able to pick it up.
Wow.
When they saw the AI, because usually our AI system will draw a box around what to see. They saw a tiny box and they're like, what is that?
Wow.
Zoom in, and then they saw it. So they were really surprised that the AI system was able to catch that thing in just still 5 seconds.
Wow.
So that's one of the key benefits. And so translating that from just AI images, that's an actual human being who potentially has developed some tiny lesion. Might not be cancerous, might become cancerous.
Yeah.
But because it's very tiny and has been detected early, potentially you save someone from developing cancer down the line.
Yeah.
So those are some of the things that I look forward to, at least more of such stories.
Yeah.
Right? Not so much when things get bad and we now need to solve it.
Yeah.
Preventing it so that it never gets to that point.
Yeah.
Like, people don't even become cancer patients at all because we detected it several times early.
Yeah.
And right now, our goal, especially with our new AI system, right, is to start predicting some of those things years ahead. Like, tell you have a high likelihood of developing some of these cancers and stuff like that. Yeah.
Wow.